So thank you very much, all of you, for staying around this afternoon. We hope that this session will draw from and build on some of the sessions that came through earlier today. We're not looking to rehash earlier presentations, but to discuss them and see what we can learn and what we can apply in our sector, particularly in light of the Minister's presentation this morning. In particular, this state's new commitment to further work on addressing the issues around family and domestic violence. It becomes even more important for us as workers in the sector to learn from what's going on around us and to take action in a very concerted and informed way. And partnerships, that word that's been coming through all of the presentations today, is something that's going to be key for this. So if I can just briefly introduce our panellists, in no particular order because they were alphabetical, but that's now gone out the window. Unfortunately, Tom Corrie, who was going to be presenting on Indigenous communities and family and domestic violence, was unable to attend the conference. So we have Professor Annabelle Taylor, who is the Director of the Queensland Centre for Domestic and Family Violence Research. She's originally from New Zealand, where she's done very extensive work in a similar vein there. Her research is on domestic violence, child abuse, how services reach marginalised and hard-to-reach populations. Does that resonate with anybody in the AOD field? I hope so. And she has a strong interest in practice, evaluating and supporting service provision around this area. Anne-Marie Laslett has also presented and is presenting again around the hidden harms of alcohol, its impact on families, children, and its relationship with substance abuse and family and domestic violence. She's a public health research fellow at the Centre for Alcohol and Policy Research at Turning Point. And again, looking at the range and magnitude of alcohol's harm to other people rather than just to individuals who consume, and its specific involvement in child maltreatment cases. And she's also a co-investigator on a WHO and Thai Health International project on harm to others. Ingrid Wilson is a PhD candidate from the Judith Lumley Centre at La Trobe University. Her research explores women's experience of fear and harm from alcohol-affected partners, certainly around this idea of alcohol involvement with family and domestic violence. And her work is looking to inform the development of policy and interventions to reduce alcohol-related intimate partner violence. Sergeant Scott Woodward, who is our gentleman, our thorn in the middle of all the roses, or is it the other way around? Is the Domestic and Family Violence Coordinator for the Queensland Police Service in the Sunshine Coast District. And he's been there for the last 12 years, checking my maths. He's an advocate for continuous improvement in services in the policing of family and domestic violence across Queensland, but he's particularly interested in the incorporation of integrated responses. So he manages the Prado Early Intervention Group, which uses a social worker to work alongside the QPS staff to manage high-risk and urgent responses to family and domestic violence. So this is practical experience of this coordinated response. And Professor Anne Roche, who is the Director of NCETA, the National Centre for Education and Training on Alcohol. She was the founding director of QUADRIC, which is the Queensland Alcohol and Drug Research and Education Centre. You can sense a theme here. She's worked with a number of the universities, but also consulted with the World Health Organisation. And she has a very strong interest in the cultural issues around drug and alcohol, particularly alcohol, and its implication for practice for workers. So she's done a large amount of work on making things applicable in the workforce. And she's spoken this morning about tools and ways to engage with people and do the screening that we're going to use as part of our discussions. So just to give you a bit of a heads up on what we're going to do, I've got a number of questions here that I'm going to throw to the panel and ask them to respond individually to. I know there will be concerns and questions from the floor. I'm actually going to ask you to hold those until the end of the session, and we'll have a big combined questions centre. That way people with walking mics can get to you quite easily, and we can foster that open discussion thing. So if I can ask you to hang on to those questions, that would be really great. Okay, timing. Right, so we hit go. And the first question to the panel, and I'm going to ask each of you to respond to this from your own background, either research or practice, and say, what do you see as the level of contribution of drug and alcohol use to domestic and family violence? or if it is your field instead, child abuse and neglect. So let's poke that bear and see how much of this incidence is due, do you think, in your experience, to drug and alcohol? Anne, first off the rank here.
First off the rank. It's a good question, and I think it's a hard question to be really accurate and specific about. What we do know from the data that's available is that a really large proportion of family and domestic violence is involved with, or I should put this the other way around, alcohol and drugs are involved with a very large proportion of family and domestic violence. And we've had long discussions throughout various sessions today about it's not necessarily causal, but it's certainly heavily implicated. So in every instance of family and domestic violence that we're aware of, there's highly likely to be alcohol and drugs implicated in some way or other, which means that there's great opportunity, which is almost largely untapped, for the alcohol and drug sector to have a much more proactive and interventionist role in trying to intervene in those components of family and domestic violence where alcohol and drugs do play a really significant role.
Okay. Let's go to the other end. Ingrid, would you like to comment from your research interviewing women?
So I suppose I specifically asked when I was recruiting women, have you ever felt afraid when your partner's been drinking? So the women that did come to me, that was part of their experience. But in terms of being able to qualitatively describe the contribution of alcohol to their experience, for most of these women, it's certainly made things worse. So while some women, they did experience some forms of aggression towards them without alcohol, certainly where alcohol was involved, they felt more afraid. For some of the women, they didn't experience any forms of abuse, except, say, for some controlling behaviours, but they certainly experienced severe physical abuse when alcohol was involved. So from their experience, it was a significant contributor to their sense of fear and safety.
Annabelle, would you like to comment on what you've seen in New Zealand and how that compares to what you've seen since you've been working here in Australia?
Thanks. Yeah, that's quite a tricky question to answer.
That's my job.
Look, I'll perhaps offer a few reflections on the relationship with child abuse particularly, because there's quite a wealth of recent work that's coming out, and it's certainly showing the relationship between child abuse and alcohol uses and drug use, indeed, as two of the factors that are associated. But there are other things that we know about child abuse too, in terms of the prevalence data, and that is that it appears to occur more often in families that have socioeconomic disadvantage and challenges. So what interests me is how it interplays with the other mix of factors that might be contributing to the violence. The question I have in regard to intimate partner violence and the role of alcohol too, and this is based on lots of work, is what is it that makes the person abuse the child or woman under the influence of alcohol or drugs, as opposed to someone else who might be drinking to the same extent but won't be exercising that behaviour. So it just highlights what needs to be investigated more around exactly what the relationship is.
Anne-Marie, would you like to comment on that? That's a very nice introduction to your work about the hidden harms. How would you see that the alcohol might contribute or perhaps precipitate?
Well, I think alcohol, while never an excuse, is a significant contributing factor in many of these situations. I mean, in the work that we've done, we've looked at data from 4 states, and there's 30,000 cases of family violence that involve alcohol across Australia, and around 20,000 cases of child protection and 10,000 children affected across Australia, where the alcohol was a risk factor because of the perpetrator's drinking, or sometimes because of the mother's protective, because the the mother was less able, perhaps, or the other partner was less able to protect the children because of their drinking. I guess the question was what was the question again? Sorry.
What level do you see as alcohol contributing to the event?
Yeah, I mean, I think it is. There are many factors that contribute to these really difficult problems that we see that we would like to solve or handle much better. So it is about alcohol and other drugs. It's about mental health. It's about domestic violence. All of these issues have an impact on how children are, are coping and living in our societies.
Mm-hmm. Scott, front and centre. When you respond to these urgent and immediate care cases in coordination with the social worker, does the alcohol come out, if you like, immediately? Is it immediately obvious when you attend?
I should probably clarify a bit my position or positions. I have a few hats, as all government employees do. My core position is the Domestic and Family Violence Coordinator. My secondary position is the Mental Health Intervention Coordinator, and I also manage Support Link, which is our, I suppose, online referral service. So when the operational police refer people at any number of incidents, domestic violence, mental health, gambling, parenting, homelessness, the list goes on, that informed consent gets put through an online system and gets farmed out to different agencies. So that integrated response and integrated agency is part of my role. All three of those roles dovetail in very nicely. Having said that, I'm trying to offload my mental health role as we speak, if anyone's interested. It's a low-paying position.
You're not doing a good job at advertising.
I know. I secretly want to hold it. Where the rubber hits the road, so where the operational police respond to incidents, and whether that's domestic and family violence, child abuse, or mental health, alcohol and drug abuse and usage, it is very common at that. And I suppose, once again, to clarify a bit, I'm dealing at the upper level, so the high risk and the recidivist people that we respond to. So I've got that overviewing aspect of it, and I suppose I'm a large piece of the chunk of glue that holds all the agencies together and calls them in for different cases. If you're familiar with the SCAN team for child abuse, it's a similar kind of thing, but for domestic violence. So in relation to where does alcohol and drug abuse sit, I can't think of a couple or an individual, for that matter, that we deal with in my team, that drug and or alcohol use and abuse doesn't feature prominently. I should have paid a bit more attention to Annabelle's presentation at the QPS conference Annabelle and I were just at. I was looking at pinching some of her statistics, and I know a lot of those are based on research, obviously, and anecdotally, it would be involved in the significant majority of all incidents we attend for domestic violence, for mental health, drug and or alcohol, same as well. And obviously that goes down to child abuse. And like my friend here said here before, it links into so many areas of community safety and well-being. You'd be here all day talking about it. Okay.
Well, let's move it on and drill down then. Given that there is an obvious involvement, and everyone agrees on this, and Anne has discussed this morning some of the tools that are available to start screening drug and alcohol clients for family and domestic violence, is that actually happening? In the services as we see them, are family and domestic violence cases and those involved being screened for substance issues? And conversely, are drug and alcohol clients being screened for existing or potential family and domestic violence? What have you seen go? Annabelle.
So we're looking at response interventions?
Just the screening to start with. Are we asking the questions to find out whether these things are happening?
Well, I'll speak from a New Zealand perspective there in terms of my both research and practice experience. And I would have to say it's a qualified response. It depends. In the early intervention area, there's some strong initiatives in New Zealand around home visitation. And so in recognising the wider research about the effectiveness of home visitation in child abuse prevention. So there's quite an investment nationally. and in addition to community initiatives. So with the prevention focus, it's either the health visitor or the social worker, and in New Zealand it's generally a social worker who is doing the intensive home visiting. It's really up to the key worker working with that family in terms of brokering and ensuring that services are connected with the family. And it's critical then, of course, that services are available. Yeah.
Okay. Ingrid?
So obviously I've interviewed a number of women, but they're certainly not representative of the general population, but just some of the comments that women had made to me, because often they're the ones who are doing the most help seeking on behalf of their partner, who has the alcohol problem but doesn't necessarily have that insight about the impact of that issue for themselves as well as on the family. So the women are doing a lot of the seeking out drug and alcohol services and even just, working through the healthcare system. What they a few of them talked about being very dissatisfied with those experiences, mainly because their own experience as a partner supporting someone with an alcohol problem, it never gets acknowledged. So, and also they did talk about particularly where their partners also have mental health issues, that then the mental health issues become seen as the predominant kind of label, and then the alcohol problems get ignored. And again, these are a number of instances in the women that I spoke with. But what this served to do was very much deny their own experience of how big a problem that their partner's alcohol use was creating for the family. So if anything, I would encourage drug and alcohol workers to ask questions about, or from the partner, about what is it like at home. And then you may well be able to kind of tease out, whether the partner's safe, whether the family's safe, and perhaps be able to kind of link in other services in that way. But just by asking those kind of simple questions of the partner might also be helpful.
Okay. Anybody else want to jump in? Yes? Anne-Marie.
About 20 years ago, I think I worked in Benalla for a little while and was looking at the relationships between alcohol and other drug workers and child protection workers. And it seemed back then that often they wouldn't know who their parallel worker was. Benalla's it's a reasonably sized town, but you would think that people would know who the person was that they might be able to make those referrals to. And I think back then too, AOD workers might not know whether their client had children, and from the opposite side, opposite angle, the child protection workers might not have any idea whether their client was affected by alcohol and drugs, and whether the situation was worse when their father or mother, or if it was a partner that was reporting about how the way the children had been affected, whether they'd been affected. So I think it's actually moved a long way since, but I think there's still a way to go in terms of people discussing how alcohol and other drugs might be affecting children. I think they have made changes in Victoria recently to the online screening system. So now it's a regular question that it does pop up: does the client have children? And in the child protection system, it's alcohol and other drug uses in Victoria is only supposed to be recorded when it is significantly contributing to the problem. But whether this actually happens like that, I don't know, because I think practice will vary, because I think training varies, and because individual workers' own perspectives and understanding of how problematic alcohol can be. Often they say, what do they say? A problem is only a problem if it's worse than your own level of drinking. So if you have child protection workers or other workers that normalise intoxication around parenting, then they're not going to find it a problem.
Mm.
So.
And when you were doing the consultation to develop the tools that you described, what sort of reaction did you get from workers? Is this a whole new idea? Were they screaming and waiting for it? How ready was the sector to start asking these questions?
Can I just jump back to your previous question for a moment? Then I'll answer that one as well. So you prefaced your previous question by saying that there was an obvious relationship or an obvious connection between family and domestic violence, child protection and alcohol and drugs. And at one level that is obvious, and there's decades of research and there's decades of data that show, quite clearly what the nuanced and convoluted relationship often looks like. But it's invisible. So on the one hand, it is obvious. On the other hand, it's invisible if you're working in a particular context. And if you're working in the alcohol and drug context, much of it is invisible to us because it's not part of our legitimised agenda of issues that we look at. So I think that's the initial grappling point. So what is obvious and black and white in one context, if you move to another sector that you're working in, doesn't necessarily even exist on the radar in the alcohol and drug sector. So it's not necessarily obvious at all. So hence your second question, what was the response? No, people weren't chomping at the bit just waiting saying, my God, where has this tool been all my working life in the alcohol and drug area? On the one hand, and it was much more complex and difficult that when we were producing guides for clinicians, there were very delicate, sensitive negotiations and discussions between the alcohol and drug sector and the family and domestic violence sector because we used different language, different frameworks that we operated from, different paradigms, and saw many issues in diametrically opposed ways. So it was quite a tricky process of navigating and finding common ground. So from the obvious to the invisible to the really tricky is the way I would describe that process overall. But I think we've, in a relatively short period of time over the last few years, moved a long way. I think there's a higher level of perceived legitimacy for the alcohol and drug area to now work in relation to child protection issues. And I know it has simmered away for some decades where services across the country have made really important steps to work with families and children for some decades, and it would drop off as soon as there was, invariably when there were periods of funding contraction, and then we'd try it again and so forth. So it's always been the second-class citizen to some extent, the way women and children often are. The issue about family and domestic violence, though, has never had as much of a high profile as it has at the moment, and the connection and the relationship with alcohol and drug issues, I think, is clearer and in sharper focus now than it's ever been before. So people in our sector, I think, are better prepared to understand and listen to those issues. So I think we're in a good spot in that regard.
I might move us along a little bit because we need to catch a little bit of time. Margaret has shown us very ably this afternoon how language is a wonderful tool with which we completely obscure meaning when we're talking between different sectors, let alone different countries. So we need opportunities for actually fostering this cross-sectoral collaboration so that we can identify the worker who's needed to do the parallel work with a client, to actually build an organisational strategy that embraces collaboration with another organisation. What sort of opportunities and policy options do you guys see as the big ticket items to foster this environment for us as drug and alcohol workers and for the other organisations who deal with other specialised areas who need to intersect with us? Scott?
I knew you could ask me.
Have you got learnings particularly around mental health and the comorbidity stuff that would translate to this sort of collaboration?
Yeah, up until recently I was a mental health first aid instructor, so that probably means something at some level to someone. So I do have some knowledge in relation to it, but you're talking policy and procedures. Policy and procedures,
all very practical things. We heard some wonderful stuff this afternoon from Christine Gibson about workshops that actually promoted cross-sectoral collaboration between child protection agencies and drug and alcohol organisations. That was really practical and led to, unusually, from the ground up to policy and procedural change. Have you seen things like that?
Yeah, I can definitely give you a working example. Okay, so Caboolture Police District, Sunshine Coast District, Redcliffe and I think it's Strathpine Police District have what we call Prado, which is partnership response against domestic offences. So that's the social worker that sits in my office and the other offices as well, and that has a number of different areas that my social worker Mel farms out different types of referrals to different agencies, and she has obviously performed her own risk assessment in relation to what's going on at the time for her level of involvement. The police, by the time that Mel has received her referral from the police have obviously gone through a risk assessment as well and identified certain common risk factors as far as domestic violence goes. Drug and alcohol, mental health is obviously two, not primary ones, but there's certainly ones that are there. As far as, once again, a working example, part of what I do is involved with what we call DV CAM, or DV Domestic Violence Cross-Agency Monitoring. So we have a forum that sits with the QPS, Child Safety and Department of Probation and Parole Corrective Services. We all have our different types of risk assessment tools. Alcohol, drug abuse features prominently. Like I said, we're dealing with the top end victims and perpetrators, and there wouldn't be any of those that we don't identify as drug and alcohol being an issue. If someone's on probation and parole, it's very common for them in our forum to have some kind of alcohol prohibition and obviously illicit drugs as well. From that forum as well, it might be common for the police to apply for a condition on a domestic violence order that they not consume alcohol or not consume alcohol above 0.05% and be able to be tested by a breath test by a police officer. In reality, so if we respond to an incident of domestic violence, or any incident really, we can breath test them, and as a result they might be breaching the domestic violence order, but most likely breaching the probation and parole order as well. The run-on effect of that, there's probably many. Some people might return to jail for a period of time if it's a common offence that they've already committed, for example, or they might seek further referrals through probation and parole who put them onto drug and alcohol counsellors, for example.
Okay, thank you. Annabelle, when you've done evaluations of the service provision, like collaboration between services and some of the work around Mackay, have you looked at some of the areas where this collaboration is happening at service level? What are the key factors that are the predictive of success in that collaboration?
Look, I haven't undertaken that in Mackay. When you say in Mackay, yes, I have within our research centre. Yeah. Yes, so there is a wealth of research information around the value of collaboration and coordination, and particularly information sharing in regard to that. And I guess there's a lot of very good examples, and the Caboolture one is one that I've heard about previously too, where it enables a wraparound approach to addressing and responding to the situation at hand. I guess that just in regard to that, the only comment I'd have to make about that in terms of the Australian context is the need to focus on perpetrators more. In that, thus far, those integrated services, from what I can observe, tend to be very well focused around safety for the victim. But there is a critical issue in regard to addressing the behaviour of the perpetrator in that. But I think, nationally that's been recognised here, and your national research organisation is currently embarked on looking at men's behaviour change interventions and those that work well. But look, I just wanted to mention in terms of the strategies to address child abuse and domestic violence, because I'm conscious that we've tended to, the discussion thus far, to operate at sort of tertiary level. But in terms of primary prevention, there are some very good initiatives there. And, among those are the well-constructed and well-designed education programs in the schooling system, right through as kind of an intervention which research has shown has a very good effect. And then, there's a raft of public health strategies that that may need to be considered. There's other work that's showing there's a correlation between child abuse and the number of liquor outlets in a particular geographical area. So the prevalence in that area tends to be higher. So that begs the question about, and the liquor outlets, certainly in Christchurch where I come from, tend to be more located in lower socioeconomic areas. Where there's a provision of treatment services in the same area, that has a mitigating effect. Yeah. So I think those public, the public health approach is really important too.
Okay. We are going to have to draw this to the close, so I apologise, but we're going to have to kill off the questions from the floor. Just very, very briefly, Ingrid, Anne-Marie and Anne, policy options to drive these factors.
Definitely looking at the broader availability of alcohol, the pricing of alcohol, the promotion of alcohol, and looking also at settings-based approaches where there's specific target populations such as young people who we know are high risk for intimate partner violence, as well as for the types of drinking that is correlated with partner violence occurring. So so much could be done at all different levels.
Okay.
I agree with Ingrid's comments. I think it's important to, and Annabelle's, that it's important to work at the primary prevention level, and we can get. I think these options are actually they're really hopeful, but we need to better evaluate them. So whilst we think we can, and it should be the case that increasing the price and decreasing the availability and decreasing advertising associated all leads to lower alcohol consumption, which leads to higher problems. But whether it actually, flows right up the pyramid and affects those that we most want it to affect, those who are most seriously affected, is something that we haven't evaluated yet. So we need to do something, but we need to also make sure that what we do is working. And I also think we do need greater cross-collaboration. That's just greater collaboration between the sectors. We need better treatment systems. We need more funding for those treatment systems to make sure that people don't end up in child protection or experiencing family violence or in the police or dead or in hospital.
Okay. Anne, final words. Short ones.
Very short ones. I think tying it into the funding arrangements, having it part of our key deliverables in our tertiary end services. As we said, there's been a strong emphasis on the tertiary end, but locking it in so that it's a clear and tangible objective of our programs that we run. But I think at the primary prevention end, the thing we haven't talked about is the major underlying thing about and changing the culture of masculinity, which allows and facilitates family and domestic violence and doesn't adequately protect children and families. So a real push to identify what kind of cultural shifts, what kind of strategies are required to bring about that kind of cultural shift.
Right, nothing like a bit of an easy one to finish off with then. One thing that's come through very, very clearly for the panel is that all of these issues are very, very familiar to us from the work we do in the drug and alcohol field. There aren't very many new factors involved in this. So we have culture, we have availability of alcohol, we have the asking of the questions, and we have the coordination between services to address the issues as they arise. What we're just realising is that these things affect not just our drug and alcohol sector, but so many broader issues around families. So it's important that we start to work very effectively together and start evaluating the effect of the work that we do, and continue these dialogues and continue to learn from the work that we're each doing individually, but sharing that work so that we don't repeat failed experiments. We learn and move forward. In an environment where we have very limited funding, we have to work smart. For those of us who've worked in the sector for a long time, we've never had enough money, so we're used to working clever and smart. So we need to take that practice forward and apply it very broadly across all of the issues that our clients face. I thank you very much for your attention, but I would particularly like you to join me in thanking all of our panellists this afternoon.